Welcome to today's video. In this presentation, we'll explore diabetic foot, a serious complication of diabetes. Let's dive in. Diabetes prevalence is rising globally, and foot infections are a leading cause of hospital admissions for diabetic patients. They affect 1 to 2% of diabetic patients each year and are a major cause of limb loss. The main causes of these infections include neuropathy, ischemia, immune defects, and trauma. Now let's look at the pathogenesis. It starts with diabetes mellitus, which leads to chronic hyperglycemia. This is often associated with neuropathy, causing a loss of protective sensation. One day, you might experience an unnoticed minor trauma, and then, boom, this can result in skin breakdown or ulceration. This condition is often linked with peripheral vascular disease, which reduces blood flow and tissue oxygen levels. This ultimately leads to impaired wound healing. Eventually, bacterial invasion of tissues occurs, resulting in local infection in the soft tissue. Infections can be superficial or deep. If left untreated, they may progress to systemic infection. Sadly, in severe cases, amputation may be required. Now, let's discuss how to diagnose diabetic foot. Diagnosis is based on clinical signs and symptoms of local infection and systemic upset. Look for a wound or ulcer, spreading cellulitis, fevers, or signs of critical ischemia. These indicate a more severe infection. Blood tests can be unhelpful since inflammatory markers may be normal or only mildly raised. If osteomyelitis is suspected, an X-ray may show evidence, but MRI is the most sensitive imaging modality for detecting bone involvement. Diabetic foot can be managed with empirical antibiotics, followed by culture-guided therapy. However, the definitive treatment often involves surgical management. In surgical management, debridement of dead bone and soft tissue is essential. If less than 1/3 of the calcaneum is removed, the weight-bearing function of the bone can be preserved. Reconstruction options include antibiotic-impregnated beads, vacuum-assisted closure, also known as VAC, or skin grafting and flap cover. In cases of extensive disease, amputation may be necessary. Now let's talk about how to prevent diabetic foot. Start with daily foot inspections to catch issues early. Wear proper footwear to protect your feet and maintain hygiene to prevent infections. Additionally, control your blood sugar levels, avoid barefoot walking, and ensure regular monitoring by a healthcare provider. Never self-treat foot problems, and if you smoke, it's crucial to stop smoking to improve circulation. Here are some take-home messages. Diabetic foot is a serious but preventable complication. Early detection and proper management can save limbs. Prevention through consistent foot care and patient education is key to avoiding diabetic foot issues. Thank you for watching. See you in the next video. Don't forget to like, subscribe, and hit the bell for more health insights.